Blood vessels can be divided into three different primary types. Arteries are large vessels that carry blood away from the heart. Systemic arteries are large vessels that carry oxygen-rich blood out to the body. Pulmonary arteries are large vessels that carry oxygen-poor blood up to the lungs. Arteries branch to form smaller structures called arterioles. Veins always carry blood towards the heart. Systemic veins carry oxygen-poor blood from the body to the heart, and pulmonary veins are large vessels that carry oxygen-rich blood from the lungs back to the heart. Capillaries, finally, are the smallest blood vessels. Capillaries are found at sites of exchange. Capillaries can be found in the lungs, or are considered pulmonary, or they can be found in body tissues and are thus considered systemic. The walls of arteries and arterioles contain three primary layers. From outside to inside, the layers are as follows. The tunica externa, or outer layer, is made primarily of collagen. It provides the vessel with some strength and helps to anchor the vessel in place. Moving towards the center, the second layer, or the middle layer in the wall of a vessel, is known as the tunica media. This layer contains smooth muscle. It controls the size or the diameter of the vessel. If the smooth muscle cells contract, the diameter decreases. This is known as vasoconstriction. If the smooth muscle cells relax, the size of the vessel or the diameter of the vessel will increase. This is known as vasodilation. Finally, the inner layer, or the lining of the blood vessel, is known as the tunica interna. This is also sometimes known as endothelium because it's made from simple squamous epithelial cells. This is the layer that's in contact with blood. Veins have the same three layers as arteries, but there are some differences. For example, the tunica media, or the muscular layer, is not as thick in veins and venules as it is in arteries or arterioles. Furthermore, there's less elastin, so these vessels are a little bit less resilient and stretchy. Additionally, some veins have valves to keep blood moving in the right direction. Muscular activity is largely responsible for allowing blood to return to the heart through veins with valves. The pumping of muscle alongside of veins with valves helps to squeeze blood from valve space to valve space. Here's a diagram showing the anatomy of a large vein. Please take note of the three layers. The tunica externa is on the outside, the tunica media is the middle layer that contains smooth muscle, and the tunica interna is the lining. It's in contact with the blood that's in the vein and is comprised primarily of simple squamous epithelial cells. It's also known as the endothelium. Here's a slide detailing the anatomy of a large artery. Please note that there are the same three layers that we find in arterioles and veins and venules, but there are some differences. The tunica media in an artery is usually much thicker. Also, in a large artery and even smaller arteries and arterioles, you will not find the valves that are typically found in some veins. Capillaries are the smallest blood vessels. They form when arterioles branch. Capillaries do not have a tunica externa and a tunica media. They are comprised basically of the inner layer found in the normal wall of a normal vessel. These are the smallest blood vessels we have, and in fact they're so small that red blood cells are forced to line up in a single file fashion as they pass through these small vessels. These vessels are one cell layer thick and the cells are flat and thin. This allows material to travel more easily from blood into tissues and from tissues into blood. Capillaries are ultra important at sites of exchange. These are the structures that we use to download and upload materials between our cardiovascular system and different systems. This slide shows the cross-sectional anatomy of a simple capillary. Please note that the tunica externa and the tunica media are not present. Essentially what you're looking at here is one layer of flat thin cells. This is also known as the endothelium, or more technically, is comprised of simple squamous cells. This delicate arrangement allows material to travel easily or more easily from the blood vessel out into surrounding tissues, or from surrounding tissues into the blood vessel. Capillaries are important at sites of exchange. This diagram displays the major types of blood vessels. Blood pressure is the force exerted on the internal surfaces in a blood vessel by blood. There are several factors that can influence blood pressure. The size of the vessel is extremely important. In general, if a blood vessel decreases in size, the pressure inside the vessel increases. Conversely, if a blood vessel increases in size or diameter, its internal pressure will drop. Finally, blood volume will also influence blood pressure. Blood volume generally is referred to as the amount of blood. If blood volume increases in a closed system, the pressure or the blood pressure in the system will increase. If blood volume goes down in a closed system, blood pressure will conversely decrease. Blood pressure is a useful diagnostic tool in assessing the internal environment of a patient. Because the ventricles alternate in systole and diastole, the blood pressure also ebbs and flows. Systolic pressure is the highest pressure in the system and occurs during ventricular systole or contraction. Diastolic blood pressure is the lowest pressure in the system and occurs when the ventricles are in diastole or are resting. The blood vessels closer to the heart experience greater pressure because they contain more blood, as the blood has not yet dispersed into the other branches. Because arteries are closer to the force generators of the heart or the ventricles, blood pressure in arteries, both systemic and pulmonary, is usually higher than it is in other vessels. Because veins are at the end of the system or are farther away from the ventricles on the journey, blood pressure in veins is usually lower. Abnormal blood pressure is typically a sign that there's something wrong inside the body. Hypertension or excessive blood pressure, for example, can be due to things happening actually with the heart, but also there can be other considerations like blood volume or peripheral resistance, which is caused by blood vessels. Hypotension or low blood pressure can often be explained by low blood volume and is often the result of sometimes systemic shock. Also recall, please, that the sympathetic nervous system can raise blood pressure to prepare the body for action, and the parasympathetic nervous system can lower blood pressure to prepare the body for resting and digesting situations.